Greetings to all viewers of the channel. It is the liver that is a kind of filter where the main reactions of ethyl alcohol metabolism occur. At the same time, at one of the stages of biotransformation, acetaldehyde is formed, which is several times more toxic to tissues than ethanol. Alcoholic intoxication of the liver, it is also often called alcoholic disease, includes several pathological conditions that with the constant use of strong drinks gradually replace each other. These are fatty hepatosis, hepatitis. It can occur in different forms. Cirrhosis. The rate of development, as well as the severity of the lesion, depends not only on the amount of alcohol consumed regularly. These factors are also influenced by gender. In women, alcohol poisoning of the liver progresses faster due to a lower level of alcohol dehydrogenase. Concomitant diseases also play an important role, in particular, viral and infectious hepatitis, parasitic invasions, pathologies of the digestive tract, cardiovascular system, diabetes, obesity, etc. Alcohol provokes a group of diseases. Alcoholic liver disease is a collective name for disorders that develop with prolonged use of alcoholic beverages. Most often, the following lesions occur: cirrhosis, hepatitis, fatty hepatosis. Cirrhosis is a classic of hepatology. Develops in patients who drink for a long time. At the first stage, alcoholic intoxication of the liver occurs. A complex lesion of the inflammatory process is formed. There are manifestations of hepatitis, diffuse inflammation of tissues. Gradually, the phenomena of dystrophy increase. Then, the complete destruction of functionally active cells hepatocytes. They are replaced by scar structures that are unable to perform the functions of an organ. Cirrhosis provokes a group of secondary disorders: bleeding, digestive problems, severe alcohol poisoning. Hepatitis. The pathology preceding cirrhosis is accompanied by complex inflammation of organ tissues. A person suffers from dull pains in the right side, digestive disorders. Possible phenomena of jaundice with yellowing of the sclera of the eyes and skin. Hepatitis does not go away on its own and can develop into cirrhosis or cancer. Fatty hepatosis is the replacement of functionally active cells with fatty structures. It resembles cirrhosis in nature. It also proceeds aggressively, but it takes more time for the development of persistent changes. One of the most dangerous conditions is cancer of the liver structures. Develops with hepatitis as a consequence of excessive alcohol consumption, constant inflammation. It requires immediate treatment, does not always respond to therapy, and often turns out to be incurable. The use of a large amount of alcohol is the cause of organ damage. For the development of persistent changes, problems, it takes from 10 to 12 years of systematic intake of drinks. If there are chronic diseases of the liver structures, it will take less time. Manifestations of alcohol poisoning, tissue lesions are non-specific. The violation is accompanied by a group of signs. Pains in the right side, they are mild or moderate. Intense are rare, by nature, pressing, dull, aching, heaviness in the stomach, digestive disorders, nausea for no apparent reason. Vomiting is also possible. Symptoms worsen after eating a lot of food or drinking alcohol. Gradually, the symptoms of alcoholic intoxication of the liver increase, and as the negative phenomena increase, new manifestations may appear. Bleeding, long healing wounds, yellowing of the skin, sclera of the eyes. Prolonged alcohol consumption creates additional risks. The restoration of the organ with a long experience of alcohol consumption is becoming increasingly difficult. Often it is not possible to completely recover. Whether it is possible to recover depends on the stage of pathology, its form, state of health, and other factors. Among them, age, floor, addiction experience, the quality of the drinks taken, the quality of the treatment, diagnosis, the patient's attitude to the treatment of alcohol addiction. All this adds up to a unique picture that determines forecasts, prospects for normalization of the state. Among the principles of liver recovery after alcohol, there are three main ones. The first is a complete rejection of alcohol. Even a small amount is enough to cause aggravation of the condition and ineffectiveness of treatment in addition. Before taking up the cleansing of the body, cleansing the liver after intoxication, alcohol damage, it is necessary to eliminate the narcological problem. The second is the diet. Tissues are restored gradually. Improper nutrition loads the organ, slows down the progress in treatment, nullifies it in some cases. The third principle is taking special medications. What kind of medications will be required depends on the clinical case. The question is solved by a gastroenterologist, a hepatologist, taking into account the available data. Diagnostic methods, necessary medications, the duration of the course of correction, that is, all questions of examination, treatment should be decided by a specialist. You will not be able to cope on your own. Cleaning the liver from alcohol is carried out by medicinal, as well as non-medicinal methods. At the first stage of correction, a complex dropper is shown, which contains drugs of several groups at once. Among them, detoxification solutions that inactivate alcohol, remove it from the body naturally. Rehydration drugs that normalize the water-salt balance, salt products. Hepatoprotectors are used to maintain the work of hepatic structures. They restore the function of the organ, accelerate normal regenerative processes, reduce the load. After the elimination of alcohol, its metabolites from the blood, the symptoms of alcoholic intoxication of the liver disappear. However, hepatoprotectors can be used for some time, until the organ is fully restored. The diet is needed to prevent excessive load on the liver structures. This is important for systematic alcohol consumption, binge drinking, since the degree of functional disorders is high. A gentle diet with a minimum amount of fatty, fried, smoked is shown. How long you have to stick to the new menu depends on the case. Liver treatment may be required after a binge. After the restoration of functions, in addition to hepatoprotective drugs, a diet, a complete rejection of alcohol is necessary. It is also desirable to quit other bad habits. Smoking has a particularly negative effect. When planning, deciding how to treat alcoholic intoxication of the liver, it is necessary to take into account the age of the patient, the parameters of the body. Older and younger patients are less amenable to therapy. The first is due to the wear of fabrics. The second is due to insufficient formation of tissues. There are additional risks. If there are diseases of the digestive system, the probability of early onset of severe consequences is much higher. Hepatitis, hepatosis, cirrhosis develop several times faster. Instead of 10, 12 years 5 is enough, or less depending on the primary data. Pathology should be treated by a doctor. Any attempts at self-medication, herbal medicine, folk, grandmother's recipes, are more likely to make it worse. To avoid aggravation of the pathological condition, you need to contact a hepatologist. If such a specialist is not available in the nearest access, then to a gastroenterologist. It is important not to delay. The longer there is a defeat, the higher the probability that it will not be possible to cope with it. In general, alcoholic liver disease begins with steatosis, in which fats accumulate in the cells of the organ, hepatocytes. Already at this stage, alcoholic hepatitis can develop, in which hepatocytes become inflamed and fibrosis develops, an overgrowth of connective tissue with scarring changes. With the systematic use of alcohol, alcoholic hepatitis can join at the stage of cirrhosis or lead to its development, thereby increasing the risk of formation of hepatocellular carcinoma, a malignant tumor of the liver. However, studies have shown that in patients who consume up to 24 grams of ethanol per day, the risk of death from liver cirrhosis increases significantly. For women, the dose is even lower. This suggests that if there is a threshold, it is very low and difficult to detect due to limitations in measuring it. Therefore, from a medical point of view, there is no safe level of alcohol consumption. The highest risk of liver cirrhosis is observed in people who drink alcohol every day, regardless of the dose. The probability also increases with so-called binge drinking. Addiction is dangerous because even if you give up alcohol after a while, the patient may break down again. In such a situation, it is recommended to consult a narcologist and a psychiatrist. The liver is the most silent organ. In the early stages of alcoholic illness, the patient may be concerned only with symptoms of malaise, general weakness, fatigue, and decreased appetite. With alcohol abuse, such symptoms are regarded as the consequences of a hangover. At the stage of cirrhosis, the liver does not hurt, since there are no pain receptors in its tissue, but they are in the capsule surrounding the organ. Therefore, with alcoholic hepatitis, when the liver increases and the capsule stretches, the patient feels discomfort and pain in the right hypochondrium. If you want to improve your health and prevent a huge number of diseases in your life, Then subscribe to the channel and click like, because we are talking about how to be healthy and happy.